Dr. Chris, we often get asked to describe the differences between decompression and traction. Could you please give us a quick comparison of the two?
So decompression, really came about in the 1990s, really starting with the VAX-D, and it's defined as creating a negative intradiscal pressure, and that's also the indications that people will apply in specific therapy. Versus traction. Traction's been around for 4,000 plus years. Very similar indications. It's just that decompression was really focused on creating that negative intradiscal pressure, so it's sort of taken on the connotation that it's different than traction. I sort of equate it similar to your electrotherapy device, where that one system can do sensory pain modulation, motor pain modulation, NMES, possibly some motor control, muscle re-education, just by dialing in and changing some of the parameter settings. So when we look at decompression, it's really more so identified as a specific set of parameters for a specific indication, for a specific desired outcome.
In that same vein, you talk a lot in your speeches, in your discussions about spinal distraction as compared to decompression. Is that along the similar lines?
Yeah, so I use spinal distraction as an all-encompassing term because when we use the term traction, it has a certain connotation to it. And specifically, traction may be defined by a payer, for example, of what traction actually is and how it can be billed or coded for. Also, it has an antiquated perception by clinicians and possibly even patients if they've been treated by it. Versus decompression has a similar set of purviews. In other words, people hear decompression and they think, something very, very specific. So the term spinal distraction is probably a better term. It's all-encompassing because, kind of like saying manual therapy, there's so many different ways that we can do manual therapy. Well, nowadays with today's technology, we can do many, many different forms of spinal distraction. So even though it's pulling in that y-axis, we can have different positions of the patient, we can change the speed of pull, we can change the intensity, we can change the durations, and so all of those things give us a better idea or concept of mechanical spinal distraction instead of just calling it traction or just decompression. So spinal distraction encompasses both of those and then some.